Morning, everyone.
Good
Can you
morning,
hear me?
ma'am.
Okay. So we'll start with the class now. Already 77 students have come. Can you see my slide?
No, ma'am.
Wait, I'll do. Now, can you see?
Yes, ma'am.
Okay. So yesterday's class, a little bit it was left, isn't it? So, but still I have included in today's class. We'll go with the ABO blood group system. So now, yesterday I told you that there is the presence of the H antigen is there, and then that H antigen gives rise to the antigen A and then the antigen B, isn't it? So if A is present in the on the surface of the RBC, then it becomes the A blood group. Then if it is present, then B blood group it becomes. Then if it is not present, then it becomes the O blood group. If both A and B antigens are present, then we call it as the blood group AB. So that part you have understood, isn't it? So yes, have you understood?
Yes, ma'am. Understood.
Okay. So now we will. Okay. Anybody wants to say something? So now we will go how we will do the blood grouping. Understood here? So ABO blood grouping is carried out by making the 2% saline suspension. That means, so in the RBCs, whenever we will take the blood, we will make the 2% saline suspension. And then in that saline suspension, we'll add the antisera. So the antisera, there are of different types of the antisera. One is the anti-A, and then the anti-B, and then the anti-AB sera is also there. Understood here? So usually in your practical, only anti-A, anti-B, and then the anti-D sera is given, but still later on, if somebody tells anti-AB sera, then you should not be confused. That's why I'm telling here in the class that, okay, anti-AB sera is also there. But in your practical, only anti-A, anti-B, and then the anti-D sera is used. Is that clear? So now, here the ABO blood grouping is carried out by making the 2% saline suspension of the red cells. So now we will, whatever blood we will take, we will add and then make the 2% saline suspension of the red cells, and then we will add the antisera. Those antisera are the anti-A, anti-B, and then the anti-AB. But for the this RH grouping, we also add the anti-D. Now we are talking about the ABO blood grouping, isn't it? So that's why I'm talking here mainly the anti-A, anti-B, and then the anti-AB. So, but whenever you will do the practical, but the students, they don't have to make this 2% saline suspension, but usually whenever we will do in the blood bank, we will do with this 2% saline suspension. But when we do the practical in our lab in deep side, we will not make the 2% saline suspension, but usually it is the method how it is done. Understood here? My voice is clear?
Yes, ma'am.
Yes, ma'am.
Okay. Now you see here, there are the two methods for the ABO blood grouping. One is the slide method and another is the tube technique or the tube method. Understood here? So one is the slide technique is there and another one is the tube technique is there. Slide technique means we will take this glass slide Have you made any smear staining and all? This Listman staining, Romanowski staining, have you done? No, no.
No, ma'am.
Okay, but you know how to do practical was taken? How the slides are stained, and then how is the smear and all?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay, that is done. But you people practically you haven't done, isn't it? So okay, fine, doesn't matter. So here the slide technique and then the tube technique means, so in slide technique we'll take a glass of the slide and we'll put the drop of the blood. Usually for the A and then the B blood grouping, we'll take a drop of the blood, and also for the RS grouping. So in that way, that is known as the slide technique. And in case of the tube technique, this is done, tube technique is usually done in the, both are done in the this one blood bank for this grouping of the blood. So in the test tube technique, we'll take a test tube and we'll put the blood, this that 2% saline suspension of the RBCs, and then we'll add the antisera, and then we will see whether there will be the clumping of the RBCs or the agglutination of the RBCs or not, and then we will see whether which blood group is that one. Understood here? So two techniques are there. One is the slide technique and another one is the tube technique. So now this picture you see here, a drop of the blood is kept, isn't it? So here, so now first here the sera is kept, antisera is kept, okay, and then this is the drop of the blood. On the right side you can see a drop of the blood is coming from the tube, isn't it? So dropper it is coming. So here the drop of the blood, it is placed on the slide. So on the left side you can see even the blood is also agglutination we can see, isn't it? So here the first one is the antisera A is added, in the second one antisera B is added, and then in the third one the anti-D is added. So here we want to, this is just, I just want to show you that this is a slide method, and then blood is added and then the antisera is added in a slide method, okay? So here I don't want to tell you in detail. In the other pictures I'll tell you. So here this picture I have kept just to make you understand how is the slide method. Slide method means we take a glass slide, we put a drop of the blood, and then we will put the slide, antisera we will put. Understood here? So this is a slide technique or the slide method. Now we'll go to the tube method. So in case of the tube method, here you can see test tubes, isn't it? So here the test tubes are here. So blood is kept, okay, and then the antisera is added. So anti-A is added in the this left slide, I mean tube, and then the anti-B is added in the middle tube, and then the anti-D is added in the tube which is on the right side. So here with this we can make out that there is the clumping, and then the one blood clot is seen in the anti-A and in case of the anti-D, isn't it? So here actually the blood group becomes, which blood group it becomes? In case of the anti-B, there is clumping. Yes, please.
A positive.
Yes, good. Okay, you all know. Okay, here the blood group becomes the A positive. So this is the test tube method or the tube method or the tube technique. Understood here? Basically, we can do it in a slide also, and sometimes whenever there is some confusion or properly we want to do, we will do in a tube method, but for your practical, you will do all these in a slide. Understood here? So now we'll go to the slide technique. Take a slide and mark it as the anti-A, anti-B, and then the anti-AB. Understood here? You take a slide and then we'll mark it as the anti-A, anti-B, and then the anti-AB. And then put one drop of anti-A, anti-B, and then the anti-AB sera on the marked slide. So here now a slide is taken. Now here the anti-A is taken, anti-B is written, and then the anti-AB is written. This is clear? Now here we
Yes,
are,
ma'am.
okay. Now here we will make the three, mark on the this one slide, and then we'll put anti-A, anti-B, and then the anti-AB. So usually in your practical only anti-A and then anti-B will be given, but the anti-AB will not be given. But later on, when you will come to the clinical side, you should know about it also, isn't it? Oh, there is also anti-AB sera, and whenever anti-AB sera is kept, where there will be the agglutination of the blood. So that you have to know. That's why I have made this slide. So here we'll take a slide and we will put anti-A, anti-B, and then the anti-AB. So here anti-A, anti-B, and then anti-AB means, so here you have to put the sera anti-A, anti-B, and then the anti-AB. Understood here? So like that sera is kept, anti-sera is kept, and then we will drop the blood. 3 drops it is kept here. So now usually in your practical only these 3 you will see, anti-A, anti-B, and then these are the anti-sera, isn't it? So here the blue one is the anti-A, and then this yellow color is the anti-B, and then the white is the anti-D. So usually in your practical like this anti-sera is used. So anti-A, anti-B, and then anti-D. So anti-D sometimes it comes in the blue color also, but in your practical only this like watercolor is there. I mean clear drop is there. That's why I have kept that anti-D sera. Now after we will label that slide, we will add 1 drop of the washed 20% of the cell to the each anti-sera. Understood here? So we will add 1 drop of the washed 20% red cells to the each anti-sera. Means now we will add the anti-sera on that whatever slide was labeled as the anti-sera A, anti-AB, and then in that one we will add the washed red blood cells. Now these red blood cells are mixed separately with the help of the applicator stick, or we can rock the slide gently. So applicator stick means a little bit small that toothpick like thing will be given, but its end will not be sharp, but it will be blunt. So with that help we can mix the slide, or we can rock the slide, means we can slightly move the slide and then we can see where there will be the agglutination. Now read for the agglutination macroscopically within 5 minutes and identify the blood group. Understood here? So here we'll leave the slide for 5 minutes and then we'll identify the blood group. Understood? This much clear? Now in that anti-sera written slide, we will add the blood, okay, washed red cells we will add, and then we'll mix those red cells and then the anti-sera with the help of the applicator stick, and then we'll rock the slide gently, and then we'll leave it for some time. So after 5 minutes, and then we will see whether the agglutination or the clumping of the RBCs has occurred or not. So now you see the picture. So now here the blood group, so anti-A is kept and then the anti-B is kept, but the anti-AB is not kept. But in the chart, I'll show you how it is anti-A, anti-AB. So now here there is agglutination in the anti-A sera kept, isn't it? So are you understanding?
Yes, ma'am.
Okay, so now here in the first picture you can see the topmost one, the anti-A, there is the agglutination, isn't it? So but in case of the anti-B where it was kept, there is no agglutination. The blood is seeing the red and then it hasn't clumped, isn't it? So there is no agglutination. So here the blood group becomes the A blood group. Understood here? So in after just immediately after that, you can see here there is the clumping or the agglutination or in the this one anti-sera B side, isn't it? So the blood was kept and there was the agglutination. So now here the blood group becomes the B blood group. And now in the third row, you can see here, there is the agglutination in both the anti-sera A side and then the anti-sera B side. So there is the clumping of the agglutination is there. So it becomes the blood group AB. Understood here? So the last one, you see there is no agglutination. Is there any clumping of the blood? No, isn't it? So there is no agglutination. That's why the blood group becomes O. Clear? Is it clear to you?
Yes, ma'am.
Yes, ma'am.
Okay. Now we will see the test tube method. So now here you see here, in case of the A blood group in the test tube, you can see where the anti-A is written there. There is the agglutination of the blood, so it becomes the blood group A. Understood here? So just by the side of that, on the right side, you can see now there is the clumping or the agglutination of the RBCs in case where there is written anti-B sera is added. So it becomes the blood group B. Understood here? So it is somewhat similar to that of the slide method only. Now in case of the test tube method, you can see here there is the agglutination of the RBCs in case of the both the test tube where anti-sera A and then the anti-sera B is kept. So you can see the clumping of the blood, so it becomes the blood group AB. Understood here? So one first became A, then this another became B, and then now the third one became the AB blood group. Now in case of the last one where there is written O, now there is no more clumping, isn't it? So there is no agglutination of the blood, RBCs. So that's why it becomes the blood group O. Clear? This is simple. I think, I hope you understood.
Yes, ma'am.
Okay. Now, when I showed you the first slide, that time I told you there is the anti-A, anti-B, and then the anti-AB, isn't it so? Yes. So now I'll tell you how now the anti-sera is kept anti-A, anti-B, and then the anti-AB, and then the blood is also dropped. That this washed red cells are also dropped. Now you see here, we will see, and we waited for the 5 minutes, isn't it so? So after that we will see for the agglutination. Now here we will see, in case of the anti-A also there is no agglutination, negative is there. In case of the anti-B also there is no agglutination is there, and in case of the anti-AB also there is no agglutination is there. So whenever there is no agglutination in all these three places, then the blood group becomes O. Understood here? Now we'll go to the next slide. Are you following me?
Yes, ma'am.
Okay. Just below that, that all negative you see here. So in case of the anti-A, there is the agglutination is there. So it is positive here, isn't it? So positive means agglutination is there. And in case of the anti-AB, there is negative is there. Understood here? But in case of the anti-AB, understood here? Anti-AB means there is the plus is there. So now there is no agglutination in case of the B, but there is agglutination is there in case of the A and then the AB, isn't it so? So it means that now there is no agglutination in case of the anti-B sera where it was added. So it indicates that the blood group is A. Understood here? So we usually, whenever in the blood bank, we will do this blood grouping, we have to add this anti-AB because we don't want to get confused whether it is having the weak agglutination and all. So that's why we add this anti-AB. So now you see after that, in case of the where the blood and then the anti-sera A was added, there is negative. And in case of the anti-B, it was added, it is positive. It means that it is showing the agglutination. Now, in case of the anti-AB also, there is the agglutination is there, isn't it so? So now here, there is agglutination in case of the B also, anti-B, where it was added, and in case of the anti-AB. So here, in case of the anti-AB, there will be the agglutination in both the cases of the A and then the blood group B, because the first one, it is having the A antigen, isn't it so? And then now this is having the B antigen. That's why whenever with the B antigen, this anti-sera AB, both having this antibodies of the antigen A and then the B, it is added. Now it becomes the blood group B. Now you see the last line, we will see for the agglutination. Now in case of the anti-A is also agglutination is there. And in case of the anti-B is also agglutination is there. And in case of the anti-AB is also agglutination is there. Understood here? So finally, it becomes the blood group AB. Is this clear to you, or should I repeat it once? Just, are you understanding this one?
Yes, ma'am, clear.
Yes, ma'am.
Okay, only two have understood.
Yes,
Now
ma'am.
you must be thinking why in case of the anti-AB, in case of the blood group A, it is clumping, isn't it? So, but there, in case of the blood group A, there may not be there will not be the presence of this antigen B, but add this anti-sera AB, the third one, this one anti-sera AB, then it is having the A antigen, isn't it? So that's why the anti-A and then the antigen A and then the anti-sera AB having this antibody A will clump. That's why it will show the clumping in case of the anti-AB. In the same way, in case of the blood group B also, though there may not be this antigen A, but the B is there, isn't it? So in case of the adding of the sera anti-AB, it will this will cause the clumping with the antigen B. That's why there will be the clumping or the agglutination in case of the anti-AB also. So now I'll repeat once again. In case of the blood group O, there will be the no agglutination in case of the anti-A also, anti-B also, anti-AB also. So it becomes the blood group O. And in case of the in case of the blood group A, there is the agglutination in case of the anti-A. And then in case of the anti-B, there is no agglutination. And in case of the anti-AB, there is the agglutination. So it becomes the blood group A. So in case of this one, third line, you can see here, there is no agglutination in case of the where the anti-sera A is added, but there is agglutination where the anti-sera anti-B and then the anti-AB is added. That's why the blood group becomes B. Now the last you can see, there will be agglutination in case of the anti-A, anti-B, and then the anti-AB because there is the presence of the both antigen, isn't it? So antigens A and then the B. That's why there will be the clumping or the agglutination of the blood. So it becomes the blood group AB. So if you don't understand this anti-AB, if you can tell this anti-A and then the only anti-B, that is also fine. But usually this way in the blood bank it will be done. But so that's why now you can know only the first two also. Now we'll come to the H antigen and then the Bombay blood group and then the RS blood group. So now your ABO blood group is finished. Now we'll come to this one H antigen and or the Bombay blood group and then the RS blood group. One second, okay, I'll just see the attendance. Any confusion with the ABO blood group?
No, ma'am.
Okay. Now we'll start with this H substance. H substance, or this I have already told you yesterday that the H substance will make this A and then the B antigen, isn't it so? So now here H substance is a precursor of A and then the B antigen here. And this H substance is present on the RBCs of people with a blood group A, B, AB, and then the O. So now here H substance will make the A and then the B, and sometimes if it doesn't make, then the blood group becomes O, isn't it so? That's why the H substance, yesterday somebody was asking me, that was nice question. So O will also have the H substance, H antigen, you are asking me, isn't it so? So I showed you the chart also. So here also the same thing is written. This H substance or this H antigen is present on the RBCs of people with the blood group A, with the blood group B, and with the blood group people AB and then the O. Understood here? So H will make the antigen A and then the antigen B. Now how these A and then the B antigens are made, understood here? So here there is the H substance is there, or it is also known as the H antigen, understood here? So with the help of this enzyme, glucosyl transferases enzymes, so these H substance will go into the different monosaccharides are transferred. So it will be transformed into the different monosaccharides, understood here? So now it will go into the different steps, and depending upon the type of the oligosaccharide chain produced. So this antigens A and then the B will be produced. Understood here? So this I told you, H substance or this H antigen will give rise, or this will give rise, this is the precursor of the antigen A and then the antigen B, isn't it? So that's why it will go into this chart. This is just for your idea only. So now here the H substance or the H antigen, with the help of this enzyme, it will go into the different monosaccharides. These will be transferred, and then depending on the type of the oligosaccharide chain produced, so how much the oligosaccharide this chain will be produced, so the antigens A and then the antigen B will be produced. So it becomes the blood group A and then the blood group B. If A is produced, then it becomes A blood group. If B is produced, it becomes B blood group, and if both are produced, it becomes the AB blood group, and if it is not produced at all, then it becomes the O blood group, isn't it so? So now, after the production of the A and then the B antigens from the H substance or the H antigen, so some H antigens will remain on the RBC surface of the blood group A, B, and then the AB, also the O, isn't it so? So here blood group, I forgot this one. In case of the O blood group also it will remain. So after the production of the A and then the B antigens from the H substance, so some H antigens will remain on the RBC surface of or on the blood group A, B, and then the AB. So now here in the ABO system, you see here the first line, you can see blood group A has got H antigen and then the A antigen. Same thing which I already explained to you. And then the blood group B has H antigen and then the B antigen. Okay. And then the blood group AB, it has got H antigen, A, and then the B antigen will also be there. So the blood group O, it will not have A and then the B antigen, it will have only the H antigens. This is clear? This is simple, isn't it? So I told, since yesterday I'm telling this several times. So after the production of the A and then the B antigens from the H substrate or the H substance, so some antigens will remain on the surface of the RBC. So in case of the ABO blood group system, group A, blood group A has got the H and then the A antigen. B, it will also have the B antigen as well as the H antigen, and then the AB blood group, it will have the AB antigen and then the H. Now, whenever there is a blood group O, it will have only the H antigen. In case of the, by this time you must be knowing that in case of the O blood group, there will be no antigen on the surface of the RBC, isn't it so? But it will have the H antigen. Now you see here, so there will be the precursor substance, isn't it so? So now here this H, capital H, wherever, can you see capital HH? Now precursor substance is written, and then in the above arrow you can see the HH, capital HH.
Yes, ma'am.
Okay. And can you see the one capital H and then the small h?
Yes, ma'am.
Okay. And below, can you see small hh, isn't it so?
Yes, ma'am.
Okay, okay, okay. So now first arrow I'll tell you, okay. Now here the precursor substance, it will make the HH. So HH, wherever there will be the capital H, it is known as the dominant. Understood here? You must be knowing dominant and then the recessive, isn't it so? The recessive, that dominant transferring, and then the Mendelian law, that
Yes,
and then the, isn't it so? Same thing. So here the same thing applies here. There is the HH dominant, or the here in case of the capital H and then the small h, one is dominant and another one small h is the recessive one. So now here whenever there will be the dominant H HH, that both this is the homozygous and another one is the heterozygous, isn't it? So one is the small h and another one is the big capital H. So it will produce the H substance. So I told you the H substance will produce the AO genes or the AA genes. So suppose in case of the AO, it will not produce anything, isn't it? So it means that it is not there, isn't it? So now here this AA genes will give rise to the A and then the H antigen. That's why the blood group becomes the A blood. Now in the second line, you see here there is the B. O means there is absence, isn't it? So BO and then the BB genes are there. So now here in case of the B blood group, there will be the B and then the H antigen will be there. And in case of the AB genes, now there will be the A antigen will be there, B antigen will be there, and then the H antigen is there, isn't it so? So the blood group becomes here the AB. Now you go to the first arrow, it is divided into the 4 arrows, isn't it? The last one you see here, now there will be the OO genes are there. So now here there is no AB genes will be there. So it will show only the H antigen. So now here we are talking about the dominant one. Capital H means the dominant gene. So now you see here in case of the recessive one, small hh, 2 hh, the below arrow. So now here there will be the no formation of the H substance, understood here. So there will be the no A. This A blood group is also not there, AO is also not there, AA is also not there, BO is also not there, and then the BB is also not there. So there will be the no antigen will be there. So it means that now it will be forming the Bombay blood group, understood here. So when there will be no H substance, then it is known as the Bombay blood group. This chart is clear?
Yes, ma'am.
Only one S?
Yes, ma'am.
Okay. So basically in this chart, I want to show you that there will be the 2 types of the H will be there. One will be the dominant and another one will be the recessive. Dominant is written here, or here it is indicated as the capital H, and then the recessive it is written as the small h, isn't it? So the dominant one, it will produce the A antigen, B antigen, and then the AB antigen, or it may not produce anything and it will remain as the H antigen. But in case of the recessive one, it will not produce any antigen, neither A nor B, or not even the AB also, isn't it? So no antigens will be produced. That's why. And then the recessive, this small HH cannot produce even the H substance also. That's why it becomes the Bombay blood group. That concept is, this is the one. So in case of your practical, suppose if you answer properly, then only will ask you the Bombay blood group. Or to some students also, sometimes we can ask, what do you mean by Bombay blood group? If they don't answer also, it's okay. But those who answer, they should have the clear concept, isn't it? So I'm teaching you here. So now this H substance or the H antigen is situated on the chromosome 19, and there are the alleles are there. So one is the dominant, that is the capital H, and another one is the small h, that is the recessive one, which I already told you, isn't it? So the capital H antigens will be produced when a person is this homozygous, capital HS, or the heterozygous, that one. So for the production of these antigens, so it has to be the either this dominant something, this dominant capital H, it has to be there, understood here. So the H antigen will not be produced when a person is a recessive one, that HS or the small HS, they will not produce any antigen, isn't it? So that's why the blood group is known as the Bombay blood group. Clear? Understood?
Yes, ma'am.
Okay, this again I'll repeat once again. So this H antigen is situated on the chromosome 19, and there are the alleles are there. So capital H is known as the dominant, and then the small h is written as the recessive one. So now you see here, this H antigens will be produced when a person is only having the dominant gene. So it either has to be the HS, that is the homozygous, or it either has to be the heterozygous, that is the one is the dominant gene and another one is the recessive gene, isn't it? So the dominant gene will produce the other antigens, isn't it? So now whenever this H antigen will not be produced when a person is having the recessive one, HH, okay, both are recessive, so it will not be produced. So that's why now in this case the blood group is known as the Bombay blood group. So people from students from India, they will know more about Bombay blood group. So now we'll come to a little bit that how it comes, all these things I told you. Now we will go through. Now the Bombay blood group is a very rare blood group, and we find it 4 in 1 million. 1 million means how much?
10 lakhs.
Good. Okay. So out of 10 lakhs, only the 4 people will only have this Bombay blood group. Understood here? So its name was given as the Bombay blood group because it was first discovered in Bombay or the Mumbai. Mumbai nowadays we call it, isn't it? So in India by the doctor Y.M. Bhende, or what is this? Bhede or Vende? In 1952. Understood here? So now, but here though, as the name tells Bombay blood group, but in case of the India, this Mumbai, so we find this Bombay blood group 1 in 10,000 people. It means that it's more there, isn't it? So it's a rare blood group in the world. Whenever we take the data, it is only 4 in case of the 1 million people or in case of the 10 lakh people, and it was first discovered in Mumbai in India by the doctor Y.M. Bhende in 1952. So the incidence in Bombay is slightly more than that of the other countries. So in India, Bombay or in Mumbai, it is 1 in 10,000 people. So this Bombay blood group is also known as the HH, means the recessive, or the H/H, or the OH group. Means the O means there is nothing antigen, and then the H means there is the recessive. This is there, isn't it? So this blood group is also known as the HH, H/H, or the OH group, small h. So genetically they are HH. I already told you. Genetically they will have this HH, so it will not produce any antigen. So these people, they don't have the H antigen, A antigen, B antigen on the RBC. So I told you these antigens are situated on the surface of the RBC, and then the antibodies are there in the plasma or the serum, isn't it? So now here you see they don't have the H antigen, A antigen, B antigen on the surface of the RBC. Now here to have a kid having this Bombay blood group, now the one of the parent should be like this. So both the parents of the affected person is either this one H, capital H, and then the small h here, capital H, and the small h means the dominant H, or the small recessive H, or the H, small h, isn't it? So whenever we will do the Mendelian law, and then the one kid will be having the HH, isn't it? So yes, out of 4 kids, one will have this HH, isn't it? So yes.
Yes, ma'am.
Okay. This slide is clear? This slide you understood?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
How many students now? Okay, 94. Previously also it was 94. Now at the end, I will not take attendance. Okay, this is the last time I'm taking attendance. Now, what are the problems in case of the blood transfusion in case of the Bombay blood group? Now you see here in regular blood group test, Bombay blood group will be tested as the blood group O. Understood here? So if it doesn't show any antigen A and then the B, then we don't do for the H, isn't it? So only in special cases we can do, but usually we don't do this. Usually people will have the ABO blood group and then the RH system, isn't it? So we don't do this H. That's why in regular blood group test, Bombay blood group people will be tested as the blood group O. as they don't have any antigen on the RBCs. Now you see here, if O blood group blood is given, now the RBC, now O blood group, now suppose if I am O blood group, then definitely I will have the H antigen, isn't it so? So if O blood group blood is given to a Bombay blood group person, now the Bombay blood group person will not have the H antigen, isn't it so? But if my blood group is O, or if somebody's blood group is O, then that person will have the H antigen, isn't it so? So now what happens? Now they produce the antibody against the H antigen, understood here, and then the transfusion reaction will occur, understood here. So now if a blood group O blood group is given, now the O blood group, these people will show it as the O blood group. That's why if O blood group is transfused, now what happens? This usually the O blood group will have the H substance or the H antigen is there. Now if that blood goes to that person who doesn't have this H antigen, now what happens? Those persons' blood will form the antibodies, isn't it so? So antibodies will be formed against this H antigen. That's why there will be the transfusion reaction. Clear? This, did you understand the last one? I mean second line?
Yes, ma'am.
Yes, ma'am.
Yes,
Ma'am, could you
ma'am.
please explain it once again?
Okay. Now usually in yesterday somebody asked me, isn't it? So in case of the blood group O, there is always, usually in the normal population, usually in case of the blood group O, we will find the H antigen, yes? So, but now in case of the Bombay blood group, there is no H antigen, isn't it so? So now, but whenever we will do the blood grouping or the testing of those persons' blood group, that time the person will show or come as a O blood group. Means though the person is having the blood group, Bombay blood group, but that person in the normal blood grouping ABO system, it will show as the O blood group. Now, to that person, some accident or something happened, that person requires the blood transfusion. Now the people will consider, oh, that person blood grouping, while doing that person who is having the O blood group, isn't it so? So now the normal person having the O blood group, in case of the ABO system, that will have always the H antigen, isn't it so? Now the Bombay blood group person is not having H antigen, isn't it so? Now the blood group O, which is having the H antigen, if it is transfused to that person with the Bombay blood group not having the H antigen, now whenever this H antigen will go to the body of the Bombay blood group, now the Bombay blood group people's body will produce the antibodies against this H antigen. So now it will cause the lysis and then the transfusion reaction will occur. Clear?
Yes, ma'am.
Okay, are you the one to ask questions?
Yes, ma'am.
Okay, understood, isn't it so? Now
Yes.
here the same sentence, if blood group O, now those people, Bombay blood group will show their blood group as the O blood group. Now if the blood group O with the normal people having the H antigen is transfused to the person having the Bombay blood group that doesn't have the H antigen. So now here this O blood group usually having the H, it goes to the persons who is getting the recipient, isn't it so? Who is not having this H antigen, isn't it so? So now here this H antigen, whenever it goes to that person, now when in our body also, whenever we'll have any infections and all, our body mechanism will make the antibodies, isn't it so? So now that person, Bombay blood group person, doesn't have the H antigen. That's why what happens, whenever this H antigen will go or transfuse in those persons, now antibody against this H antigen will be produced, and then it will lead to the hemolytic, this one transfusion reaction will be there. Understood here?
Yes, ma'am.
Okay. Now, so a Bombay blood group person can receive the blood only from another Bombay blood group people. It means that though they will be seen as the O blood group, but they can receive only the blood from the Bombay blood group person. They cannot receive from any other AB, O blood group, or that even that normal O also they cannot receive the blood. So they have to receive the blood only from the Bombay blood group person. The first sentence, that one. So a Bombay blood group person can receive blood only from another Bombay blood group person. So it becomes sometimes problematic, because if the exact blood group is not known, suppose we usually don't see for the H antigen in our blood grouping system, isn't it so? So now we will, whenever we will do this blood grouping of these persons Bombay blood group, it will come, it will show as the O. That's why this will not exactly show the Bombay blood group. It will be shown as the O blood group. Now, if urgent blood is required also, that time also it becomes problem, because whenever we will do the cross matching part, I'll come in detail later on, because here now, suppose in case of the Bombay blood group, another person's blood group is given. If it is not, if it is cross matched and seen, there will be the agglutination will be there. Understood? But if it is not, if it is given without proper confirmation, then there can be the transfusion reaction and all can occur. So here it becomes very problematic if the exact group is not known, because they will show it as the O blood group. And if the person requires the urgent blood transfusion, that time also where to find the Bombay blood group. Suppose here in Nepal somebody is having the Bombay blood group, then how to find that Bombay blood group? Suppose in places where it is more common, like in case of the Mumbai, blood banks, still they will have the list of the Bombay blood group person. Suppose they will keep the Bombay blood group person, they will, whenever it is identified, and then it is very precious, isn't it so? So it is kept in a list, and then they will not be asked for the repeated donation. Understood here? So that time, whenever somebody needs the Bombay blood group, that time only those persons will be contacted, and then the blood donation will be given. Clear?
Yes, ma'am.
Yes, ma'am.
Now, usually here in the blood bank also, what we do is usually A positive, B positive, AB positive, all these positive blood, RS positive, these bloods are available, but the negative ones, it's very rare, like the A negative, B negative, or the AB negative, or the O negative, it's very rare. So we keep a list of those people or students, and then whenever it is required, then we contact them, and then whether they can, usually people are very nice, they come and then they donate the blood. So when I was studying MBBS also, one of my friend was O negative. So that time, whenever this thalassemia patient, they require the O negative blood, all the time, every 3 months she has to give the blood. Okay, this RH, now already 11 o'clock. This I'll teach you on Sunday. Is that okay?
Ma'am.
Yes, please. Tell. Yes, please tell.
Ma'am, how do we test for H antigen? How to know if it is present in the blood or not?
Oh, that we will do with a special technique, like that anti-H, and like not like that anti-H. We will do with that some PCR like that we will do. Usually in our blood bank, we usually do with the ABO blood group. Suppose now if the person is Bombay blood group, imagine that the person is shown as the O blood group, isn't it so? So now if the normal O blood group is given to those persons, then it will show the clumping of the blood. It will not show the this normal one. So at that time, only the Bombay blood group can only give the blood to those persons. Clear? How it is done and all, usually whenever we will have problem in the blood bank with the grouping and all, then here from Manipal we'll send to the blood bank in that WRS Western Regional Hospital. Then this special techniques, other processes are there. But how exactly Bombay blood group is very rare, so I haven't studied much about this. Only this much I know, but usually we will do by the other techniques. Any questions? Okay, Russell, did you understand?
Yes, ma'am.
Okay. Anjali, did you understand? All of you understood? You raise hands. Okay. So in my next class today, I taught you about this, how the blood grouping is done. And then after that, I taught you about the Bombay blood group. And then this RS system, or this, whether we call it positive, negative, isn't it? So because of the D antigen. So that I'll teach you in the next class. So today, okay, thank you so much.
Thank you, ma'am.
Thank you, ma'am.
Okay.
Thank you.
Thank you, ma'am.